Dr. Rima, we are back on the air.
Welcome back to the Dr. Rima Truth Report. We have a very special guest with some extraordinary experiences and insight. You know, we've been led to believe that we don't have to worry about Ebola anymore, that we don't have to worry about infectious diseases, that tropical diseases don't affect us here in North America, where most of the people listening to this show are located, and that infectious disease is something that somehow injecting poisons into your body in the form of vaccines can take care of. All of those beliefs are wrong. Our guest for the Dr. Rima Truth Reports today is Dr. Bryan Frank, who is a physician who understands things very differently from that and who has had the experience of missionary work in places like Africa to give him an on-the-ground kind of experience. That, am I still on the radio here?
Yes, you are, Dr. Rima.
Yes, okay, because another call came in that I'm hanging up on. So, hello?
We're with you.
Okay. The wonders of Skype. And by the way, the sound quality is not wonderful, but in order to make this interview with Dr. Frank possible, we're doing things that we don't ordinarily do. So bear with the scratchiness and listen to the wisdom. Dr. Frank, welcome to the Dr. Rima Truth Reports.
Thank you, Dr. Rima. I'm glad to be here. I've enjoyed the last few weeks as you and I, General Bert and Ralph, spoke on the phone a few weeks back and, reviewing your websites and so forth. And I'm happy to be here with you today.
Well, thank you so much. Let's jump right into it. Dr. Frank, tell us a little bit about your journey, and that's both your journey of choice and development and your physical journeys, and tell us about your work in disease-ridden places, making those diseases go away. Talk to us.
Well, I began medical school. I was in the charter class at Texas A&M University College of Medicine, and that was a great experience. I followed that with a pediatric and neonatology internship, and then pursued an anesthesiology and pain medicine residency program. And so, classically trained as an intensive care type practitioner specialist. But I'm unusual in the sense that before I was ever even starting medical school, I had, through needs in my own life, I had begun training in acupuncture and nutrition, and those were very important to me. That didn't make it real easy during medical school, but I was able afterward, as I got into private practice, to bring those full circle into the practice. And so I've been very active in an integrative practice for 30 years. I did then go back in the last 6 years and got boarded and became a fellow through the anti-aging and regenerative medicine, which is, I think, a real positive movement because we're looking at natural, generally non-pharmaceutical approaches to health and wellness rather than just medicating disease. And along with this journey, I've spent 30 years as a missionary overseas, Kenya and Africa, Nepal and India, over in Asia, Ecuador, Mexico, in Latin America, Dominican Republic, Haiti, and other places. And I have had both the privilege to serve in those little villages, and whether it's on the coast or up high in the Andes, I've had the privilege of serving people who, have little or no access to health care, and increasingly have found that natural things do well, and we can promote health in those settings as well, rather than just medicating the symptoms.
That's a very, very interesting way of putting it, Dr. Frank. First of all, let me tell you how much I respect someone who has been able to keep the perspective of health even in the fire hose information onslaught and of structured pressure to lose the perspective of health and think only instead about medical care, which has little to do with health. So I congratulate you for that. I also congratulate you for your loving heart, and you're willing to devote your time and your life and your skills to people who have no access to it. So when you went out as a missionary, when you go out as a missionary, because that's still a very active part of your life, you're not just bringing satchels full of antibiotics and blood pressure medication. You're doing something different. What are you doing?
Well, we go into these communities and as often as possible, and of course we do have some of those conventional medicines when we're backed up against the wall. But our goal is to use conventional medicines as little and short of time as possible and use natural things to help actually resolve the problem and lead a person back to wellness rather than just medicating a symptom or a disease. So, for instance, at our work in Kenya, we've got 6 years of tremendous experience using nanoparticle aquasol silver, and we have, well, it used to be many patients, and as we have treated the community of their malaria, then we're seeing the incidence go down in the infection rate, which is exactly what we want to see long term. But, you know,
So wait, let's stop right there. What you're saying is that using a natural health promotion strategy, you're reducing the number of patients who require your services. Aha. So what you're doing in Kenya, in that case, with malaria, using nanosilver for the resolution of malaria, which is by now, among those of us who understand natural medicine, it's almost old hat. Yes, you get 100% cure rate with malaria. Yes, indeed, with nanosilver. What you're doing is actually striking at the very heart of the medical industrial hold on the population, because what you've said is, and we have fewer patients. There are fewer cases. In other words, if you were selling nanosilver to these people, or if you were selling some anti-malarial drug, you would be putting yourself closer and closer to out of business by inducing health. Is that not correct?
Well, you know, there is a potential. I mean, even in medical school and specialty training, we would sort of laugh and say, yeah, our goal in life is to put ourselves out of business. But realistically, we know that people make choices in diet and lifestyle, that there will always be a need for healthcare or medical providers. And of course, our conventional medical model has some remarkable successes. And if we get into a motor vehicle accident or we come down with a life-threatening emergency, I'm grateful for all the advances that we have made in conventional medical science. My rub is when we try to promote every encounter with a patient to how many prescriptions we can write to treat one symptom or another, when very often, whether it's on the mission field or even in my own clinic, we try and assess the situation and say, okay, how'd you get here in the first place?
Excuse me 1 second. I think we have some interference on the line. We're getting the sound of typing, and it's interfering. We have enough sound problems. So
we sure do.
However that's happening, if we can make that stop, it would be great. Please go ahead. This is most important and most interesting.
Well, and another thing, Dr. Rima, is that we found as early in our years in Kenya, we found that many of the American volunteers that would go over and serve in our work there, they would typically take Loriam or doxycycline or one of these pharmaceutical preparations, and not uncommonly, they would have side effects that were not insignificant. And we began to realize that as we were consistently treating patients that were very sick, many times near death with malaria, and clinically within 24 hours, we saw such remarkable turnarounds. Then over the last 5 years, for instance, my wife and I and our teams, we simply take silver prophylactically, because if it can cure it, we have confidence that it can prevent it as well.
Well, now, that's very interesting. General Burt, Counsel Ralph, and I do exactly the same thing using our 10 parts per million nanosilver. And we are not permitted under U.S. law to say that we are preventing anything, that we are treating anything, that we are curing anything, that we are mitigating anything, or that we can diagnose anything using nanosilver, because it is in fact a nutrient. And as a nutrient, U.S. law prohibits us from associating those terms with it.
May I add to that, of course? May I add to that, of course, unconstitutionally prohibits us. You know, and we are, Dr. Frank, very carefully setting up a case which we believe will have tremendous precedence based on the attack on us over nanosilver. You know, we've gone to court against the FDA a number of times. Natural Solutions Foundation has been in existence for 10 years, founded in 2004 by Dr. Rima and General Burt. And we've been to court with the FDA, about 5 times? And
we've
mostly
won every time.
Right. On one level, we've won because the government backs off. On the other level, the courts almost always say, by the way, you don't have standing to sue. Well, now we've got a warning letter, which presumably gives us standing to sue. And we carefully responded to the warning letter as required by law. We gave them exactly what they required, which was a plan of compliance, while protesting that it's unconstitutional to make us take those words down, the 5 words that Dr. Rima alluded to: diagnose, prescribe, treat, cure, mitigate, whatever, however many words they may be. And the Constitution does not allow them to do that. Maybe if the government has the power to require us to speak, it can require us to speak the factual truth. That is, I swear to tell the truth, the whole truth, and nothing but the truth. But it can't force us to express an opinion we don't have, namely that we intend or do not intend a certain food to have a certain effect on the well-being of an individual. And we think we can overturn that restriction on speech because there's strong Supreme Court precedent reaching back over 100 years, and as recently as 2002, actually, that makes that sort of compelled opinion unconstitutional. So this is one of the main things we'll be doing in the coming year and in the coming 2 or 3 years, because it'll take that long to get to the Supreme Court. We also filed a formal citizens petition with the FDA, asking them to exercise their regulatory discretion and allow us to make reasonable claims about nanosilver. We'll see what they do. I'm sorry, Dr. Rima.
I'm very well aware of the terminology we need to be careful with. That's why I think what I said earlier was we feel that we can prevent it, but that doesn't mean that we can. I don't have a study to prove that, but I can tell you that I've gone back year after year after year, and the people that have taken our nanosilver have never come down with malaria, and those that we treat have done remarkably well. So we, it is frustrating. I don't really care if we make claims or not. I just want to help people get well.
Well, the FDA cares very much if you make claims, and they don't want to help people get well. That is my contention now. When I left medical school after graduating in 1970, it was my firm belief that there was such a level of misinformation and, shall we say, successful propagandization in the agencies and among doctors, that it was simply a matter of correcting the errors before things began to change in the right direction. I now understand, some 44 years later, that they understand perfectly well what the realities are, and they are bound and determined to suppress and to distort those realities because of their other agendas, which include their own personal conflicts of interest. We just published a little essay about the FDA that makes it clear that statistics on a new study show that 90% of the conflicts of interest about which they are informed in their expert panel members are not reported. So they intentionally fail to report 90% of what they know, and these are very substantial conflicts of financial and professional interest. And the net result is that they continue to suppress information that would save lives. But tell us more about what you do in your missionary work. First of all, who's we? Are you
I appreciate that. Yes, we're called Global Mission Partners, and Global Mission Partners, Inc. is a Oklahoma 501c3, fully approved, not-for-profit charitable corporation.
What's your website?
Yeah, I appreciate that. The website is www.globalmissionpartners.org. And I would love for listeners to go visit and see what we do around the world. And if they want to contribute, there's an avenue to contribute. If there are people listening that say, gee, I've always wanted to travel with a purpose and help people in remarkable places, we take volunteers, have taken volunteers from all over the United States for, over 20 years. And so we've got some exciting opportunities where we serve. So globalmissionpartners.org. And so, Kenya is but one of our mission opportunities. We have served, probably 26 or 7 times over the last 15 years in Nepal, stretching not only in the hills around Kathmandu, but all the way up to the Tibetan border and down to the Indian border. So we've got a lot of very, very dynamic work going on there. We use healthcare to go in. We do health camps in these small villages, but it also opens us up to do other works too. Depending on the specific country and communities, we set up women's skills development so that women who are in many ways marginalized in male-dominated societies and, really can be financially and socially in difficult place. We have women's skills development. We employ seamstress and sewing masters to train women. We get donations of sewing machines and cloth so that they can learn and actually be gainfully employed. We do microfinance so that we help set them up with vegetable and fruit stands, and they can make daily gain to support their family. We have a lot to do with water wells so that there will be clean water. We support education. And so, the health camps are a big part, but it by no means is the only thing that we do.
Dr. Frank, why? What motivates you from your core to focus on faraway people who have needs that are so different from the very real needs of the people who are closer to home? What's your heart like that takes you there?
Well, my motivation is faith. And so, we go and we serve everyone, no matter what race or religion or creed. And we have volunteers from all different groups that go join us. But my personal motivation is one of faith. And so when in Matthew 28, it tells us that when we serve those that are hungry and poor, when we care for those that are sick, then we're caring for Jesus. So that's my personal motivation. But, we have no requirements on anybody we serve. We have no requirements on anybody that goes to serve with us.
Right. That is a wonderful approach. Dr. Rima, this is a very interesting doctor you've brought to us today. I'm fascinated by what you're doing. It's just extraordinary. We've had some contact with, of course, the countries of West Africa, and we've had a close relationship with Father Godfrey of the Shanghai Institute down in Benin. But you, I'm sure, have had much more direct contact with some of the areas of the world where healthcare is most desperately needed. And we would love to hear some stories about your own experiences in West Africa or anywhere else in the world. Where have you been? What have you seen?
I've recorded some of those. In fact, I've written a number of books, typically on pain medicine and acupuncture and radiotherapy, things like that. But recently, at the request of some people that know what I do in Mission, they said, listen, you've got over 30 years experience in over 60 countries on 6 continents. Can you write a book? And so I recently came out with a book called Travel Well Naturally.
Travel Well Naturally.
Talk about that book.
That's fascinating. And how can people get it?
Talk about it.
Right.
Well, that was a fun project because that takes, like I say, 30 years, 60 countries, 6 continents of experience, and how you travel and stay well without, not with pharmaceutical approach, but how you do that naturally. And so, yes, of course, there's a chapter on nanoparticle silver. Yes, there's and the second thing in my bag always would be activated charcoal. But then I go through botanical and herbal preparations. I go through homeopathic remedies, and I go through essential oils. And the idea is to kind of give people a breadth of understanding as to what is natural and available out there that truly has some remarkable potential to help people stay healthy. And of course, it's not only for travel, because these things apply to those that stay home as well. Being a pain specialist, I put a chapter in there as to when you have pain issues, what are the options for dealing with that more naturally? And then I take all of those chapters and I kind of sum them up and help people develop a first aid kit that would be a natural first aid kit when you travel. There's a fair number of resources in the back appendix, and that is so the book is titled Travel Well Naturally, and the subtitle is An Essential Guide to Staying Healthy on Personal, Business, or Mission Travel. And it's available at traveldoc.info, I-N-F-O. So traveldoc.info is where to get that.
You got to help me with that.
About 3 months ago.
That's travel, that's HTTP, or is it www?
I don't think it matters.
Okay, and it's travel.info.
Traveldoc, like doctor.
Yeah.
Traveldoc.info.
Oh, traveldoc.info.
Yeah.
Is it DOC or DR?
No, travel, TRAVELDOC.
Got it.
.info.
Got it. Okay, we'll make sure that on the archive version of this broadcast, we have links and information so people can get to this fascinating book. So, Traveling Well Naturally, you said nano silver and activated charcoal, and you've made a few other mentions. What is the biggest risk that people who are traveling in those areas face? What do they be concerned about? Is it malaria? Is it hemorrhagic viruses? What should they be concerned about? Foodborne illnesses?
Well, probably foodborne illnesses is the most common internationally, and so we address that repeatedly throughout the book, and then it depends, what is endemic in those areas. Where we go in Kenya, we have a lot of malaria. If we go to Sierra Leone right now, there's going to be a lot of Ebola, in Liberia and so forth. When we go to Nepal and India, we have the potential for foodborne illness, but we have the kind of the standard cough and cold and flu type stuff. And those can either really halt your travel and impede what you're trying to accomplish, whether it's for fun, because one of my favorite hobbies is to trek it around the world, and whether it's Machu Picchu or the Himalayan Everest region or whatever, I've done all of these. But when you get sick, that really creates a real problem. Or if you're able to keep going, you feel miserable. So, whether it's GI-borne illnesses, foodborne, or whether it's cough and cold and flu, those are probably the most common. But then you get into these things like Ebola and the other hemorrhagic fever viruses. Regionally, you get into the malaria really in a lot of parts of the world, and that's why a lot of people that go on projects that are in areas where that malaria is endemic, they're taking medications, prescription pharmaceuticals, to try and prevent an infection, and sometimes they have pretty significant side effects with those pharmaceuticals in their own right.
You know, coming at it from a completely different point of view, Dr. Frank, you and I are converging, not surprisingly, on a couple of interesting points. I maintain, having practiced drug-free medicine and psychiatry quite successfully for about 44 years, and I do mean completely drug-free. And I agree with you, by the way. I'm really happy that emergency rooms exist. I'm really happy that modern diagnostic procedures exist, but they belong, in my opinion, in the emergency room and the surgical suite, and pretty much nowhere else most of the time. So it is my contention that using nanosilver 10 parts per million, which I wish we were permitted to say is the universal antimicrobial, but we're not. The FDA would not allow us to say that, so we don't say that. But it is certainly a powerful immune system support, which makes it possible to not come down with various kinds of infections, whether parasitic, viral, or bacteria. But using nanosilver 10 parts per million, totally non-toxic and incredibly effective at what it does, and using natural methods for moderating and modulating pain and inflammation and degenerative processes associated with inflammation, especially using things like CBDs, cannabidiols, which are produced by the body and by the industrial hemp plant, so you can replete, you can re-nourish the body with CBD, and using just a few other natural means, virtually no pharmaceutical is necessary absent a surgical emergency or an emergency that takes you into the high-tech specialties present in the emergency suite and the surgical suite. But you came at that from your wisdom and your experience in missionary work and extensive travel. I came at it from my work in finding other ways besides pharmaceutical ones to treat a vast array of problems and conditions, including pathological aging. So it's very interesting. My first husband, who got a lot of things wrong, did get one thing right. He got right the concept that the answer has to make sense. And when the answer makes sense to whatever the question is, the answer will arise spontaneously in multiple contexts because it's the right answer. So I was listening as I was, and as I was reading your excellent book on traveling healthily, naturally. And thank you for providing that for me. It was a great treat. I was thinking how very interesting it is that the answer makes sense, and it's arising from your experience and my experience, which couldn't be more divergent.
Yeah, there is, like you say, we're crossing paths now, even though we've come from divergent backgrounds. But, you know, even if I'm in my clinic here in Oklahoma, Dr. Rima, you know, the typical physician is going to see 40 to 60 patients a day. They spend an average of 3 to 7 minutes with their patient, and they're going to write, you know, 2 to 4 or 5 prescriptions. To me, that would be a pathetically frustrating way to spend a day at the office with my patients. I see, in a full day, I see no more than 12 to 14 because there's so much of healthcare that involves education that I spend a minimum of 30 minutes with my patients. And that's with all of them, even if I've seen them for the last 3 years. We're going to sit down and go through, you know, how's your life right now compared to where it was before. We look at, you know, there is some remarkable testing out there now, whether it's metabolic and inflammatory testing or micronutrient testing, things like that. But the unfortunate picture is that the typical patient goes to their doctor so they can be treated for symptoms and disease classifications. There's no effort. And in fact, the conventional doctor would never say, well, we can cure your hypertension, or we can cure your diabetes, or we can cure your, bronchitis naturally. And it doesn't make them bad doctors. It's just that they came through a particular system that has demanded that they represent things that way.
I used to think it didn't make them bad doctors. I've changed my mind. With the internet, with the information flow available, with the weight of evidence, science-based evidence that shows that drugs kill and natural methods cure, I now believe that however they rationalize it for themselves, indeed, those who fail to open their minds to these new means, or very often those who use these new means, or these sometimes ancient means, these other means for themselves and their families, but do not do so for their patients, like pediatricians who do not vaccinate themselves, who do not vaccinate their children, but who do make a third or more of their practice income from vaccinating their patients. And this is very common throughout the medical spectrum. Cardiologists who do chelation on the sly, but tell their patients that chelation is voodoo science, and what they really need are cardiovascular surgeries and drugs and so on. Those are very bad doctors. I don't care if they're your friend or your neighbor or your co-church member. They're humbugs, and they are frauds, and they are killing people. So for my money, these are the bad doctors. There is no excuse now not to know about acupuncture. There is no excuse not to ED. There is no excuse not to know about nanosilver. I just read an article yesterday that a journal study that says that doctors understand about the rules for limiting the use of antibiotics, but they break the rules because it saves them time in the office. Instead of arguing with patients, they write a prescription. These are very bad doctors.
Yeah, it can be greatly frustrating, but fortunately, there is a growing movement, and we're part of that, where we know that we can promote health and wellness. We know that there are vast resources through nanosilver and charcoal and through CBD and through, a change in diet and lifestyle, where, because when a diabetic comes to me, I ask them if they just want to treat their illness or if they want to get well. And typically they say, well, I thought I would have this the rest of my life. And I said, well, you will if you don't make changes. But if you want to make the changes, then the vast majority of diabetics can be healed. But it does take stepping back and look what we've done as a people, and look what we've done as a country. My goodness, the things that the government requires of our farmers, and then it's illegal for a farmer to take and keep his own seed to sow his crop the next season. That's crazy.
It is actually more than crazy. It's intentional, and it's aimed at destroying the independence of the farmers. And the word crazy should be supplemented by the word evil.
Evil, yeah, that's the next word on my mind too.
Yeah. Absolutely.
But we can make choices, and it takes some time for some of our patients and a little bit longer for others. But as we continue to educate them, then they make wiser decisions, and they gradually the veil comes down, and so they find out why it is a smarter choice for diet and lifestyle to eat only organic, grass-fed, meat protein, or to eat organic fruits and vegetables rather than the stuff that has so many pesticides and herbicides and chemicals. And they say, well, it's just a little bit. That won't hurt me. Well, it is hurting people. We've got a massively obese society, and a lot of that is simply by choices that we've made naively, but it's time to wake up and change those choices.
Let me tell a little story. If you are a subscriber to our newsletter, the Health Freedom Action E-Alerts, then you read this story this week. But if you're not, and I really think you should be, so you need to go to www.drdr Rima, R-I-M-A, Truth Reports.com, drrimatruthreports.com. Put your email information in, and then you will be a subscriber to our Health Freedom Action Alerts, which has lots of important information. Well, the story that I told is this. My vulnerable organ, and we all have at least one, my vulnerable organ is my kidneys. I don't know why, it just is. And under enough stress, my kidneys go on a work stoppage. And if the stress isn't relieved through meditation and the proper alteration in my schedule and so on, then they just shut down even more. And this is a definite bad thing because, as I say often, if a major organ system ain't happy, ain't nobody happy. So when my kidneys get really unhappy, it is time to pay attention to them. So I decided, and trying to stop a genocide and being attacked by the major mainstream media and the FDA and the FTC and the banksters and the agencies of power all at the same time, that's stressful. So I decided that I needed to do something. So what did I do? Well, the first thing is that I got some organic parsley, lots of it. And I started grinding it up with a half a head of garlic, organic garlic, and 3 or 4 tomatoes, organic tomatoes, and drinking that, and the juice of a lemon, an organic lemon. And I started drinking that several times a day. My kidneys got happy. They started working. And I added in organic watermelon, very good for kidneys. And my kidneys got really happy. And they really were making up for lost time. And I immediately started feeling much healthier. My blood pressure went down and so on and so on. Now, I could have, as a physician, gotten myself any kind of diuretic I wanted. I would also have gotten myself the possibility of serious and possibly life-threatening side effects, including rebound swelling, and hypertension, including cardiac arrhythmias and the possibility of sudden death, which I consider a negative, including the possibility of electrolyte imbalance affecting every cell and function in my body, including a whole plethora of things that I would rather not have, thank you ever so much. And instead, I used parsley, watermelon, lemon, garlic, deep breathing, standing up from my desk, playing my guitar more instead of just staying at the computer more. And lo and behold, instead of having symptoms and a continually downward spiral of kidney function, I have normal kidney function, and nobody ever died from parsley and watermelon.
Yeah, I enjoyed reading that when that came across in my email. That was, and that reminded me, because you do that, and your listeners and readers, they're going to say, "Wow, she really does this stuff." I remember when I had a group of about 80 on kind of a ministry sabbatical in France one time, and one of our participants had a serious problem, and he knew me as an anesthesiologist mostly, and yet I pulled out natural things and some acupuncture needles and did this, and he said, "Well, I've heard you talking about that, but you really do it." Well, yeah, absolutely. We're going to make the best choice we can, and very often the best choice is in natural integrative health as opposed to conventional, and it's exciting to be able to make those choices not only on the mission field or not only in my clinic in Oklahoma, but to make them in my own home as well.
So in addition to the old saw, dead doctors don't lie, we now have a new one, live doctors take care of themselves.
Well,
yeah, and we better practice what
healthy live doctors, right? Exactly.
And I really did. When that story came across about Dr. Rima and her urine issues and the watermelon and the other things she used, I thought, man, that's just about exactly the same formula that I would use.
Very nice.
Right. So, these things make sense. They are also part of traditional the stress rich world that we've allowed ourselves to be part of. But people have been facing deteriorations or dysfunctions in the body for a long time, and there's a vast amount of accumulated wisdom that guides us. And then on top of that, there's a vast amount of new information, like frequency medicine, which I use extensively in my practice, like neurobiofeedback, which I use extensively in my practice. So when you put the new information together with the old information, and you do so respectfully and thoughtfully, there is quite literally nothing, and I do mean nothing, other than surgical emergencies like getting, thrown out of a car and landing on your head on the side of the road or whatever. Those things do require conventional hospital-based interventions, but other than that, I haven't found anything in 44 years of what I call cataclysmic primary care that hasn't responded well to natural interventions, advanced interventions, and traditional interventions. So my clinical experience, not on the road, because when I travel for the Natural Solutions Foundation, I'm not performing medical services. I tend to meet with presidents of countries, ministers of health, ministers of education, ministers of agriculture, and ministers of finance to help them make public policy choices that will save their population's lives and health. So I'm doing something different when I travel. But the power of what we have to offer, and by the way, the tragedy of the weaponization of the world's food supply through the agency of Codex Alimentarius, which is also weaponizing our food supply in the United States, is something that people need to understand and make different choices about. Eating organic food, or biodynamic food, even better than organic, is one of those choices. And yeah, you might pay a little bit more, you might even pay a lot more, but just exactly how expensive is cancer? How expensive is autism? How expensive is MS? How expensive is obesity? How expensive is death? Pretty expensive.
Yeah, absolutely, very expensive. And you mentioned the ministers of health and so forth. That's absolutely one of the things that we've seen is so critical to try and educate and persuade some of these high officials. The recent Ebola crisis has really, we've had open doors and then closed doors, whether it's silver or whether it's ozone or a variety of other things. When we were in Kenya this spring, Dr. Pedersen had done a study in Ghana, and it was a smaller study but substantial, where they had 100% of those patients were cured from malaria. I'm not making a claim there. I'm just reporting what his study showed. And so we were interested to go and repeat that type of a study. And when we went in and shared with the regional minister of health, he's a very dark African man, and he turned about as white as me, because he said, why you can't do that? And I said, well, we've been doing it for the last 6 years. And he said, well, you can't bring things into this country without telling us. And I said, well, respectfully, sir, we tell immigration and customs what we bring every single time. I said, it's not a drug, it's a nutritional supplement. It's a mineral supplement. And so we went with plans and even had grant support to do a 90-day trial and get hundreds of patients to document, and that was shut down because there's, either the powers that be or Big Pharma or whatever, they're all tied together in some way so many times that they block legitimate and good approach to clinical research.
This is exactly what has been happening with us with regard to nanosilver and Ebola in West Africa. And
exactly.
we've received reports back from public officials there that basically say The only money that we have available is the money that WHO and the big donors give us, and they will not allow us to spend it. Now, on August 12th, on what what we offer, on August 12th, the WHO issued a statement that it was ethical to try even unproven interventions, and there was a duty to evaluate them. Yet apparently that WHO statement during the Ebola crisis has been roundly ignored by the authorities. One of the people that we work with tried to get through to Doctors Without Borders, and he was told quite explicitly, unless it is a pharmaceutical, we're not going to look at it.
Not only that, I regard the Ebola crisis, and I would be very interested, Dr. Frank, to get your experience, to get your response to this.
In the last 15 minutes of the interview, by the way,
yes, and we're very grateful for your time, Dr. Frank. Before I make my comment and get your response, would you give us your website again for both your excellent travel and home health book and your missionary website?
Yes, I appreciate that. The book Travel Well Naturally is available at the website www.traveldoc, that's TRAVELDOC .info, and Global Mission Partners website is just that, www.globalmissionpartners.org.
I have to tell you that I found your book very disappointing in one way. There was absolutely nothing I could disagree with.
Well, I appreciate that.
That's an interesting recommendation. Okay, we got it.
It was a very, very interesting book, and I was glad to have had you share it with me and to be able to read it. Now, what our experience with the Ebola crisis has been, in a nutshell, is that even when the governments of both Liberia and Sierra Leone were willing and eager to use the nanosilver that we supplied to them with the protocols for a clinical evaluation of this nutrient, in this case, based on U.S. government research, irrefutable research, for how well the immune support provided by the nanosilver against Ebola works. Even then, WHO actively interfered. In Liberia, they shut down the clinical trial just as it was beginning, saying WHO would not permit the use of nanosilver in the clinical trial. And in Sierra Leone, after the President and the Minister of Information delivered our long-delayed shipment to the Port Loko region and used it on about 500 patients, Ebola patients, who then stopped being Ebola patients by no longer having Ebola. We can't use the cure word, so they stopped having Ebola and they were healthy thereafter. Even so, WHO has forbidden them from reporting the results, and every doctor and nurse in these African countries is completely under the domination of WHO, and they have forbidden them from acquiring any more nanosilver. Forbidden them, meaning, for me, and this is the point that I would like to raise and get your response to, Dr. Frank, you may or may not agree with this. For me, this is the smoking gun of the genocidal hypothesis. For a long time, we've been convinced at the Natural Solutions Foundation that the powers that be, the global powers, are quite serious about population reduction because they say so in their own writings. And this we see as one of the many, many clear evidences that their intention is genocidal population reduction, and Ebola is one of their tools. I would love your response to that.
Well, there's certainly, because of the resistance to not only nanosilver, but quite honestly, it doesn't have to all be about nanosilver.
Right.
A team went over with ozone therapy and had demonstrated remarkable results and dined in the home of the president, and then after that they were shut down. So
Exactly, Dr. Rowan.
I have a friend as well that has actually been invited by Sierra Leone to come over with a completely different approach to natural immune support. And so far, he's getting green lights, and I'll keep you posted on that. But absolutely, when they shut down nanosilver, or they shut down ozone, they're speaking out of both sides of their mouth when they say natural and unproven things should be tried because of the scope of the crisis, and then they go shut them down. You could drink a bottle of your silver every day for 70 years and not have any side effects to it, and quite possibly live a much healthier life in the process. And I'm not proposing that people drink a bottle. I'm just saying it has a safety value. It doesn't have to just be about
nanosilver.
Remarkable,
I'm sorry, go ahead.
Well, what we're trying to do has a remarkable safety value, and clinically, but also we don't have to just look at our clinical anecdotal evidence. There are reams and reams of studies that show in vitro, in the lab, that silver has its effects on bacteria, viruses, parasites. Like malaria is a parasite, not a bacteria, and fungi. And so there are just reams of in vitro studies. And yes, we can't make clinical claims based on an in vitro study. That's true. However, if it were a pharmaceutical, they would take that information in vitro and then merge it over into the clinical realm rather than block it.
Exactly. The rules are different. And the game is not on a level playing field at all. So the place where the change is going to come from is from people like you, Dr. Frank, organizations and people like the Natural Solutions Foundation and what we do, and most importantly, from the public, which is going to say, oh no, I know what I want for myself, my child, my body. I don't want vaccinations. I want natural, clean food. I want essential oils. I want nanosilver. I want ozone and chelation therapy. These are the things that I want. And I demand the right to have the information and the access, which is what health freedom is. If you don't own your own body, if you can't make those choices for yourself, let's see, do I want OxyContin or do I want acupuncture? Let me see. And then you get to choose. If you can't do that, then the corporations own your body and you are a slave.
Well, yeah, that's right. Another area that I spend a lot of time with, not only in my clinic here, but also overseas, is we use acupuncture, but we also use prolotherapy to literally regenerate healthy joints or to regenerate weakened ligaments and tendons. And, Dr. Rima, 80 to 85% of the patients that come to me and have been told by their orthopedist that they need to spend $75,000 to $100,000 for a total knee or a total hip surgery. We spend $1,000 or $2,000 and literally regenerate new healthy cartilage within that joint, or literally regenerate new healthy ligaments and tendons in that rotator cuff or tennis elbow.
Absolutely. Prolotherapy, which, by the way, we haven't mentioned on this show, but prolotherapy is another remarkable treatment, demonized, because all those surgeries don't take place, because all those drugs don't get taken, because all those procedures don't get carried out. So, of course, you have to demonize the easy, simple, natural way of doing things. Prolotherapy is a wonderful treatment. It isn't just, as you said, it's not all about nanosilver. It's about natural health options, and that includes so many options. This is a fundamental concept, and it all goes back, in my mind, to who owns your body. If you don't own your body, then, we're dealing with a completely different kind of legal structure. And I'm going to hang up on this call and not take it because it's interrupting us. Good.
Yeah, but
you'll just have to wait, whoever you were.
This is a very powerful point being made, Dr. Rima. You are right. Go ahead.
That's why the Natural Solutions Foundation was created 10 years ago, because I saw in my practice of natural medicine of many sorts, including neurobiofeedback, miraculous demonized therapy. I saw that we were losing the health freedom battles one after another rapidly because we were not thinking strategically and acting tactically. We were only as a movement, as a health freedom movement, we were reacting as we were losing each battle. And you never win a battle on the defensive. I learned that from my military general husband. And so we decided that we would take on the health freedom issue full time, full force, full face. And that's what the Natural Solutions Foundation does. And you really need to be a subscriber to our newsletter because we're defending you. We'd love to have your donations, but you need our information. So go to www.drrimatruthreports.com and sign up. It's a complimentary subscription, and I truly believe that you need it, just as we need you as part of the force for change. Dr. Frank, what's the most important thing you want to tell people during this, the remaining time that we have together,
which is about 3 minutes,
which will reach many, many people?
Well, I would encourage people to get educated, to take responsibility for their health. Their physician should be one who hopefully will guide them and direct them. But individually, even you and I, Dr. Rima, when we get sick in some way, we're responsible. And so we really need our patients to understand that responsibility as well. I love it when I come to the clinic or even on the mission field, and I have someone that has taken that responsibility and started some good things. And so, you know, whether it's silver or charcoal or herbals, botanicals, homeopathics, whether it's acupuncture or prolotherapy, all these things that I do on a weekly basis in my practice, there's a lot of options out there. And so I would encourage patients to understand that most of conventional American medicine is geared towards treating illness and treating symptoms, and to make that shift and decide that they want to become well rather than just treating symptoms and disease classifications.
You know, it's very fundamental. It's either a choice to suppress symptoms and take the consequences of that very poor choice biochemically and biologically, or to enhance health and take the consequences of that very powerful and positive choice biochemically and physiologically. And that is the fundamental choice. The easy, quick way. Oh, by the way, a Harvard University study showed that the average time between the point when a patient starts talking and a doctor starts writing a prescription, the average time is 23 seconds. So you say, doctor, I have pain, and Shazam, you've got a prescription for pain. I don't know, I'm having trouble sleeping, and Shazam, you've got a prescription for a sleeping pill. This is not medicine. This is barbaric travesty of medicine.
Yeah, it's really more like dog lab.
Yes.
So that's really what it's like. Here, we've got this symptom. Let's pump this drug in and see what happens.
Indeed, the population is the final stage in all FDA drug approvals. And about half of all the FDA-approved drugs eventually either get withdrawn from the market because of their dangers, or they get their indications drastically changed in order to try to limit some of those dangers. So yes.
Would you please talk about dog lab? I know what you mean, but most people don't know what dog lab is.
Well, dog lab is a common approach to biochemistry and physiology, where you will typically have an IV and a dog, and you will be monitoring their various different physiologic parameters. And if you're testing a new drug, then you'll give that drug and identify what happens in the dog lab to that patient physiologically. logically. Um, but we ought to be doing better than that. Well, not only with our dogs, but we ought to be doing better than that with our people, with our patients, with our own families. And we just need to understand that except in severe accident and injury, except in occasional severe infections that do need to be attenuated first, but then followed up, say, with our natural integrative approaches, conventional medicine has remarkable things to offer, but the indications, in my mind, are fairly limited in focus.
Conventional medicine, in my mind, has two jewels in its crown and a lot of empty sockets. One jewel is emergency room care, and the second, that is cataclysmic urgent care. And the second jewel is modern diagnosis, which is not perfect, but it's a pretty bright, sparkly jewel, leaving out the excessive use of CAT scans and other radiation contaminated procedures. But other than that, the jewels are glass, and they're leaking toxic things into the environment.
Right, the old paste jewelry that they used to make.
Paste jewelry, right. Yes, exactly.
Indeed, toxic in this case. All right. Well, we have reached, Dr. Rima, the end of the program. Actually, we're a minute over, but that's okay. We'll fit that in. Dr. Frank, thank you so much for being here. Dr. Rima, do you want any last comments to Dr. Frank? How do we stay in touch with you? We want to stay in touch. That's what we want to do.
And I appreciate the bravery. I know firsthand what it means to buck the tide and to do things differently. I want to appreciate your bravery as a clinician, not just your generosity as a missionary. So thank you on behalf of your patients and the people you educate, Dr. Frank. Our guest has been Dr. Bryan Frank, a physician in Oklahoma with a global heart.
Thank you, Dr. Rima. Look forward to continuing, our relationship, you and General Burton, Ralph and me, and if people want one last Christmas gift, go to traveldoc.info and get that book, Travel Well Naturally. It'd be a great way to top off Christmas for some people.
It is. It would be a wonderful gift.
Fantastic. Thank you both.